So with springtime here, people starting to get back into playing soccer, back on the golf course, start running outside, we start to see more incidents of lower leg issues in the clinic. Plantar fasciitis, Achilles tendonitis, a lot of these things go hand in hand, and a lot of them are caused by the same thing, limitations in the joints and how we move through our lower body. So we're going to go through a couple of different stages of things that we can do to, one, ideally prevent these problems, but two, the similar process can help to treat it if I've already developed it. So we're going to start by trying to normalize the soft tissues in the foot and the lower leg. We've got our trusty lacrosse ball here. So I can start just massaging the bottom of my foot. You can use a golf ball, lacrosse ball, any kind of dense ball. I can do this while I'm watching TV, 20-30 seconds, just trying to search and destroy and find any of the tightest areas into the bottom of my foot. We do that on both sides. Once we're done the bottom of the foot, I'm then going to grab a foam roller. We've talked in length about foam rolling, but I'm going to roll out the big muscles of my calf, down the middle, outside, inside of my calf. I can even split it up to the most muscular part of the calf and the more tendinous Achilles tendon part of the calf. I can even go through some range of motion work with my ankle as I roll out my Achilles tendon. So again, it doesn't take a lot of time, 30 seconds a minute each side. Once we've done that, we want to start mobilizing the actual joint. So a good test to see if you've got mobility issues in your lower body is, can I stand with my feet together and sit myself down into a deep squat? So we'll see a lot of people, even just with a regular squat, have a hard time getting down because they lack mobility around the ankle, around the knee. It causes their center of gravity to shift backwards and they feel like they're going to fall back. So a way that we can test whether this is an ankle problem is, I can kneel down onto a cushion, keep my heel on the ground, and then see how far I'm able to translate my knee past my toe. So in a perfect world, I should be able to get at least a fist's width past my toe. Obviously, depending on how long my feet are, how long my legs are, that may change. But I want to know that if I'm blocked to the point where I just can't move any further with my knees well behind my toe, we're going to have a really hard time getting into good squatting positions or doing a lot of activities because of the limitation of the ankle. I can fix it by kind of doing the test. I can use the weight of my body pressing in and making sure that my knee tracks out. I don't want to do these mobilizations with my knee tracking in. That's just going to give me knee and hip problems. I want to maintain the integrity of my arch and start working on getting that ankle to mobilize. I want to pay attention to see as I do this, do I feel more of a stretch through the back of my calf, or do I just feel like I hit a wall in front of my ankle? If you feel like you hit a wall in front of your ankle, you've probably got some more serious ankle stuff going on that you're going to actually physically need to come into the clinic for and have worked on. If we're just getting that tight calf, foam rolling, stretching, loosening up that tissue is going to be probably most of what we need to do. Once we've got the soft tissues taken care of, we've mobilized the joint, we've kind of tested whether or not we have an ankle issue. We're going to start working on strengthening the foot. So I want to think, if I bring my foot up to the edge of a tile, we've talked about this before, can I use the intrinsic muscles of my foot to elevate my arch without crunching my toes up? So can I grab the ground with my feet? We can then use that strength, we'll think of that as like grip strength for our feet, as we just start working on single leg balance. So I should be able to bring my thigh up to about 90 degrees, should be able to hold my balance nice and steady for at least 10, 20, 30 seconds, and then as we become more confident with that, then we should be able to do that same thing with our eyes closed. So I want to have really good, efficient balance with my eyes closed, just knowing that I'm getting good information from the joints of the bottom of the foot to my brain. Last thing we can work on, I'm going to need a little bit of traction, so we're going to throw our shoes on. And if we come around to the side, we can use the frame of a door or a machine at the gym. I'm going to sit myself back into my hips, bringing my foot right up against the post, getting nice and tall as I wind myself up to get a really good stretch through the back of my calf. I don't want to let my back start rounding. I'm always organizing my spine when I stretch. So that's going to help me get a really good stretch through the back of the calf. A way that I can do a different angle is I can bring myself down into a tall push-up position, work my way into a downward dog, and start driving my heels to the ground. And I can do that in different positions where I bring my leg a little closer to my body, or I can work my leg a little further out from my body just to hit the calf in different angles. So work on the soft tissues, get the joint moving better, strengthen our grip strength from the ground up, and make sure that we've got the appropriate length for the muscles Do that, you can get out on the golf course, play a little soccer, go for a run, and avoid